Welcome to Body Innovations. My name is Susan Nash, and today we're here to begin the transformation of your health. The first thing that we're going to go over is a couple of the core mechanics and how they apply to your core strength and your overall health. Today we're here with Martina, and she's going to do some demoing. She's also just had a baby, and not everybody viewing this film today will be in that same scenario, but you may have been to the doctor and you all might have been told, you know what, there's nothing in the core, you need to strengthen your back and your core. So today we're going to look at that for you. So the first question I usually get is, what is your core? Well, your core is the deepest abdominal layer within your body. So it acts as your internal corset. It is the one next to your organs, and it actually starts up underneath your ribs, like the last 6 ribs. It comes all the way down. It starts through your back and it comes all the way around. So it actually is an internal girdle for your body. So it can affect, it also has, it joins in with your diaphragm and with your pelvic floor. So I want you to think of your core, I like to describe it for simple terms as a barrel. You've got a top through the diaphragm, a bottom through your pelvic floor. Pelvic floor is really important when you think of having a healthy lifestyle, which I always say, a good, natural, healthy lifestyle. You use your floor, you've got to urinate, you've got to defecate, you've got to have sex, you've got to have babies. There's lots of things that go on in a healthy lifestyle. So to actually enjoy your life, you've got to make sure that the bottom of that barrel is going to be able to withstand all that life has to offer for you and not leave you empty-handed with all kinds of issues. So let's have a good, healthy life. So the next thing we're going to do is actually look at posture. I'm going to use Martina here today just as a demo. So when you're looking at your posture at home, I want you to look in the mirror, and the first thing I'm going to have you do is, Martina, stomp your legs and then land your feet. And I'm just going to roll your pant leg up so that your legs, you can see your knees. So when you're looking in the mirror at home, I want you to have a good look at your feet. And I want you to notice, do your feet actually rotate out? So then, Martina, let's pull one out, or maybe just one, bring one back in. So notice, where do your legs land and what's going on with your feet. Bring your feet back to normal, because I already know your posture. And notice as well what's going on in the arch of your feet through here. Do you actually have an arch, or do your feet cave in? So can we cave yours in, like so? And then cave out, so you're on the outside edges of your foot. You could have either of these scenarios. And then I want you to cast your eye up towards your knee and notice, with your knees, are your kneecaps centered over the first and second toe? Or does perhaps one leg rotate out, and even possibly your foot could even come out with that? That's also something you might see. This will affect what goes on through your pelvis and then through your core. So there's always a reciprocating effect that goes up the chain. So I like to, make you notice what's happening at ground floor, because you could try to fix everything here, but if it's starting down here, we're going to always run back into trouble. Then I want you to place your hands on your hip bones. So the actual hips, feel for the crest of your hip, and notice when you're looking in the mirror, are they level, or is one coming up higher? So you want to just get an idea, are they level? Then we're going to drop your arms back down. Now I want you to cast your eyes on your shoulders. Are they level, or does one come down, or are you nice and even? You should be even through here. Take a look at your hand position. Is the palm of your hand forward, or does it come to your side? So normal position would be the arm at your side with the palm facing your body, as opposed to being forward and the palm rotated here. This can indicate that you have chest, you could be tight through your rotator cuff, through your chest, because we spend our life on a typewriter, or not a typewriter, but a computer. All these things can lead to tightness up through here. Also take a visual of what's going on through, I call these windows, on each side of your waist. Is one arm hanging out more than the other? That can indicate a shoulder problem that's going on. And now I'm going to turn you for a second before Marcus gets tired. And just take a look from the side position of your head. Very difficult for you to do by yourself, but you could certainly ask someone close to you who will give you an honest answer. The head, or say the ear, should be in line with the middle of your arm. So if your head is forward, it's going to affect a tight chest, a dropped position through your rib cage. It will affect your breathing, which will also affect your core mechanics, because they relate all the way down into that pelvis for you, as well as giving you neck tension and head tension. And it's not going to give you a good posture or a really good, strong abdominal that we actually want. The other thing to notice is the low back. Now there's a natural curve that exists between the neck and the low back. After pregnancy, so how many weeks are we after? 8 weeks. You're still having that pregnancy after being drawn, your abdominals being drawn out. I call, there's 2 types that I will just refer to easily as Donald Duck and Pink Panther. Donald Duck is after a pregnancy, or you might even not have had a baby and still be a Donald Duck, and your pelvis tips forward into this big arched position through here, and you can still see that it's going to still exist for Martina here. And as we strengthen up her core and bring her pelvis back into position, that will start to come back into a little bit better position. So when you're a Donald Duck, I want you to think of when you're standing nice and tall, if this was a bowl of water and you're a Donald Duck, you spill all your water out in the front. If you're a Pink Panther, you don't have a lot of curve here. You go flat in the back and all your water is spilling out through the back of you. Donald Ducks like to lock their legs. Do you find you do that? Do you find that you lock or not lock? So pregnancy alone has pulled you into Donald, and you're still pretty good through your leg position. Some of you out there might find, oh, I can totally relate to that. I lock my legs and I do one of these, okay? Sometimes sports can do that for us, or it's just habit. So now, after discussing that posturing with you, we're going to bring you down to the floor and start the beginning of your core mechanics. So to begin with, I'm going to give you a little bit of a core activation prep that we do here. So I'm going to have Martina bend your knees. And the first thing I want you to do is tip your pelvis back and forth. So notice you can flatten in as you're tipping it back and forth. I don't want you to actually use your glutes. Just notice as you rock back and forth, there's a little bit of abdominal work going on there as you tip back and forth. And then you come to rest in what you would just be in a comfortable position for you today at 8 weeks postpartum. And I want you to notice how much space do you have underneath that belly button area. How much goes under there? A hand, about a palm width? Okay. So normal width or space underneath your low back and right underneath the belly button area should be about a grape or enough to fit the palm of your hand. And you certainly, you know, having your whole arm slide under your back would be a little bit excessive, and that's definitely more related to what I would call that Donald Duck posturing. And if it's completely flat, then you're more likely to be more of a Pink Panther. That will affect which posturing I give you for starting your abdominal core work. So now I'm going to have you make a triangle with your hands and place that thumb in the belly button. So it's on the belly button in the thumb area, and the fingertips go down toward your lower abdomen there. I want you to visualize that triangle almost as a coaster. And now I want you to tip the pelvis back again. So as you tip back and flatten the back, I want you to get that visual that when you're in a flat back position, if I had a glass of water here, it would pour all over your chest. And now I'm going to have you tip it the other way. And when you tip it the other way, now the water's pouring out between your legs, and you're out of, say, that neutral position for you, and then bring it back into a level position. So when you're in the level position, that triangle should feel that it is level or, say, parallel with the floor, and that you could have a drink on there and you feel fairly comfortable with that, right? Now, how does that feel for you? Fine. So now I want you to take a breath in and just breathe naturally. You're just breathing here and you're just noticing. I just want you to notice that when you breathe in, does the coaster go up? And as you exhale, does the coaster go down? Yeah, so it does happen. So for a couple of you out there, you might find that, hey buddy, that as the coaster, you might find, ooh, my coaster doesn't go up and down. So in diaphragmatic breath, when we use the belly and the diaphragm properly, the belly should, as you inhale, the coaster would come up, and as you exhale, it would come back down. This is an excellent technique for you to just practice if you have trouble sleeping. I usually, don't visualize my coaster, but you could put, I have little rubber ducks I often put there, and I teach people to just breathe and let the duck go up and down, and it'll put yourself to sleep pretty quickly. So that deep breathing can put you into a very parasympathetic state and make your whole nervous system calm down. So for some of you, you might find that, oh my gosh, I don't move at all through here. Martina's good with this, it's not happening for you, but for some of you out there, you might be saying, uh-oh, I'm not breathing. What that means is that you're really using only the upper quadrant of your lungs to do your breathing, and you're really not accessing the lower lobes of your lung in a diaphragmatic breath. That will also affect your core and the core strength. So practice the diaphragmatic breath, because I really want that activation so that you can continue through the program and get the most out of your work. The next exercise that we're going to prepare for is that core activation. So what you're going to do here, we're talking about the floor. So these are the muscles that you would use. You might have heard them referred to as a Kegel. So I want you to draw your pelvic floor up. So it's the same muscles you would use if you were trying to urinate and you're going to stop the urine. But you're going to draw that pelvic floor up, and then I want you to draw your belly button down towards your spine, and then think of it as coming out your head. And then you're holding that contraction, but you're still breathing, and then let it release. Now my first question is always, did you feel the contraction? Were you able to find it? Okay. So for some of you out there, you may not have found it. So I want you to place your hand underneath the, right underneath your belly button in the small of your back. So under, we're going under. Going under. And what you're going to do here is you've got the hand there. I want you to think of lifting the floor up and then drawing the belly button down towards your hand using your abdominals. Don't squeeze on your butt cheeks to do this, or press your feet into the ground. You're using your abdominals. Think of the reins of a horse. Like you're going to pull, your hip flexors come up into this area. So I want you to think of pull the reins of the horse back as you use your abdominals to create that sense of pulling back without actually structurally moving anything. And can you feel pressure on your hand? You got it? When you feel the floor coming up, you feel the reins of the horse pulling back, you dissipate it out through the top of your spine so it's leading out your head. You feel that strong contraction, you're breathing, and then release. I'm sure that was more than 10 seconds. How did it feel? Good. All right, so that, if you know, the first question is yes, could you find that feeling? If you can't, I need you to practice this, and once you can start to feel that pressure underneath the hand, now we're going to begin to actually lead you into the exercises. I have 10 exercises for you to do that now start to involve you actually get to move things and use the core mechanics. So if you can't feel this working, you just practice with this one until you can maintain for 10 seconds feeling that pressure work for you. So my next exercise is going to involve a foot lift. So you're going to actually, you could choose to put your hand behind your belly button, or if you can find that contraction, I think you're pretty good without it. You may not need to have your hand here. So the first thing you're going to do is draw the pelvic floor up, and then you're going to think of the reins of the horse as pulling back, a nice strong contraction. You're breathing. You're stabilized through your hips, so nothing's moving. Could you lift one foot off the ground and maintain that contraction, and now let it come back down and let go of the whole thing? And we're going to try that with the other foot. So you're going to lift your floor up, think of reins of the horse to stabilize your pelvis so that the arch underneath your back doesn't change. Yeah?
Is there a particular order that I should be releasing the muscles?
When I'm first teaching, so if you've looked at some of the postnatal information that I've had in other film, you'll notice that I do have you release in an order. So if you are new to the whole concept, I want you to engage the floor first, then draw the belly button toward the spine, lift it out the head, and then you release the abdominals first and then the floor last, especially if you're a person who's having pelvic floor issues. If your pelvic floor is strong, we can release everything at the same time. But when the pelvic floor's had trauma, such as childbirth, we're going to let that go last. That's my last one that I'm letting go, and it's the first one I start with. So always think ground zero, and we're working up and then going back down, okay? So we're going to start again by lifting the floor up. Think of the reins of the horse to pull back. Good, you're stabilizing there. And you're going to lift the other foot off. And notice there's a little bit of movement as you go through that. Now you're going to lower it back down. Did you feel if the arch increased? Did your arch increase as the foot come up or down? You don't feel like it did. Okay. So as you continue to practice this, let's try one more contraction just so they can get a view. I see a little bit of movement here, and as you practice these at home and go home with them, you really should be moving at the hip socket and not seeing the hips move side to side or listing back to forth. So I run a really strong contraction as you're lifting those legs one at a time. Okay. So now I'm going to go to my next exercise. This is exercise number 2, and I use something called a Gertie ball. It's a soft ball, so it's actually very squishy. It's something that you usually will find in a specialty store of a children's toy store, and it usually comes flat. You put a little straw in it and you blow it up, so you can put different amounts of air in it. So what I'm going to do is place this Gertie ball underneath your feet. So the Gertie ball, your feet are resting. The thing I like about the Gertie ball is that it tells you, because you can feel the weight, I can push into your legs, you can push into it, and you can feel that the ball will squish. I can see the ball squishing, you can feel the ball squishing. So it's a good information relay back to your head. A solid ball will work, there's no question about it, but it won't give you nearly the feedback that a squishy ball, such as a Gertie ball, is going to give you. So what you're doing here is, again, you're going to find your neutral position. And we're going to go back to your same exercise, but now your feet are resting on the ball. So you're going to start with drawing your floor up and think of the reins of the horse pulling back and lifting out through the head. Stabilize that position and just lift that foot off and then lower it back down. And then try that with the other leg. So you're going to lift the floor up, the reins of the horse go back, and you're trying to not let the position of the arch of that back flatten or arch as you lift it off. As well, we're looking to see, does the hips move back and forth? So after having a baby, we expect that this is going to be a little bit more challenging and a little bit more difficult. Let's try 2 more. So think pelvic floor, and then you draw the belly button toward the spine and lifting it out. Pelvis is stable, and get the leg to go back. Try 1 more. Good. And then lowering it back down. Now with the next exercise, what you're actually going to do is put 1 foot on the floor, and I'm just going to move Marcus a little bit. There we go. He's heavy. Okay, there we go. So now from this position, what we're going to do is engage your abdominals again. So belly button toward the spine, you're lifting that pelvic floor, stabilize yourself, and now roll the ball out. So notice your leg is going to be heavy on the ball, and then you're looking to see if the arch of your back increases. Don't let it increase, bring the ball back in. And then try that 1 more time. Pelvic floor, abs engaged, take the ball out and bring it in. You might say, this is a breeze, not a problem. So if it is easy for you now, when you take that leg out after our activation, you're going to make this leg really light. So I want you to divert the weight of your leg and pull it into your abdominals. This is where you're going to start to feel the reins of the horse. So you're really trying to keep it much lighter and then bring it in. So much harder? Should feel a little bit harder. Now the second part of that, so that's the modified version. First with a heavy leg, then with a lighter leg. Now I'm actually going to use this leg comes up into a knee float. So bring the leg up into a knee float position. So knee float is when the shin is parallel with the floor. And from here, now you're going to draw that belly button toward the spine, engage through your floor. And now take that ball out. This will be harder. So legs got to go out, and then it's going to bring the ball back in, and then lower the leg back down. I'm going to switch that to your other leg so people can see from this view what that's going to look like. So we'll bring this leg up to a knee float. So again, you've got to find your pelvic floor, stabilize your position so that you don't have a huge arch under your back. And as you exhale, you're going to roll the ball out and then bring it back in. How does that feel? Harder? This is a harder version of this exercise. Could you make this leg, when it gets easier, a little bit lighter as you go out? You might not even be able to go out as far with the leg as you keep it lighter, and then bring it back in. How'd that feel?
Much more.
Yeah, it's much, much, much more work. Now with the next foot exercise, I'm going to bring this foot back down, and I'm actually going to take this ball away. So with this exercise, what we're going to do is bring both legs up to a knee float. So you start with them here. So this is knee float. I'm going to give you the modified version. This is would be my exercise 4. To start with, I'm going to let your shins drop. So both your shins come down into a drop position. So modified version of this toe tap. What you're going to do is turn on your abdominal muscles. So pelvic floor engages, you stabilize through your pelvis, and as you exhale, you're going to take one foot down, let it tap the floor, and come back up. And did your pelvis arch? Were you able to feel how you did this really well? And then try it with the other leg. Goes down without arching, and then you're going to exhale and take it down, and then exhale down, inhale up. If you find the breathing difficult, it's an exhale down, inhale up, or you could exhale all the way down and up, pause, take a breath in, and exhale, other leg down, bring it up with the exhale, and then breathe again. So it's whether you like a nice long breath. If you're all tangled up in your breath, do what's easiest with the slow exhale through the whole motion. But you're fine with that one. You've been working on this is baby number 2 for you. Now I'm going to increase this, exercise number 5. We bring the shin up to a parallel position. So this is much more difficult. You have to work much harder. How does it feel?
It's more work already.
More work already? We haven't gone anywhere with it. Okay, so now what you're going to do is you engage through the floor, pelvic floor up, belly button to spine. Can you move by bringing one leg down to tap the floor? And then bring it back up, and then exhale, take the other leg down, so you're alternating, and then bringing it up. Perfect. So Martina did a perfect job here, but I want you to show there's a definite modification that you might find you're doing and not know you're doing. So the modification, if you think you're doing the exercise right, but you're actually making it easier, is when you go to lower the leg, you actually bend the knee and drop into the fold. So let's show that. So as you exhale, you would go down and see how she's moving more at the knee. She thinks she's moving at the hip. Now do it the correct way. So as you go down, you move at the hip, keeping the angle of the knee the same. So the leverage of the leg is actually staying in a much harder position for you to create that movement. And then bring both legs down. And now we're going to move on to exercise number 6. So for our next exercise, what we're actually going to do is place the ball back under your feet. So your feet are resting on the ball. Now, this is a lateral movement with your abdominals. So what you're going to actually do here is you find your neutral position through your spine, and you're going to draw your pelvic floor up. Belly button goes toward your spine, lengthening it out through your head. And now you're going to open one leg out as if it's opening to the side, but you're going to keep your pelvis nice and level and then bring it back up. Now with this particular move, you want to watch that as one leg comes out to the side, you don't use the opposite leg as a counterbalance so it's not falling out. And then exhale, bring it in. And the other thing is that I want you to think about the back of your pelvis and try to keep the weight even. So as the leg drops out, you shouldn't feel that you're shifting or falling into the hip that's coming out to the side. So you're just taking the leg and being able to drop it out toward the side to whatever extent you can while maintaining the pelvis in position. Now with this particular exercise, you would work up to being able to do 30 seconds. Say I call it time under tension. So you want to work up, maybe you could accomplish 10 seconds to begin with. But my goal is work toward 30, and when you can do 30 seconds, we want to work up to a minute of you being able to just follow that natural motion. And when 1 minute doesn't feel like any work anymore, I could take it up to 2, or you can just leave that exercise and carry on into other progresses